Hello everyone, I'm Jaki Lowe, the Director of People and Inclusion. As you will be aware, last week we refreshed our health risk assessment process to make sure we incorporate some of the developments that have taken place in our response to COVID over recent months. This mainly includes the introduction of the COVID vaccines and the lateral flow tests, which I'm sure you'll agree are fundamental in the way that we're able to manage this next stage of the pandemic. Having received a few queries over the last week, I hope it will be useful to set out what we're asking colleagues to do with the health risk assessments. So firstly, please make sure you participate in the assessments. Please make sure you have one for yourself, and for those of you who line manage other members of staff, please make sure all of your team have one too. This is an important part of your role as a manager in protecting the health and well-being of your team. To be clear, we now want everyone to have an up-to-date health risk assessment, no matter whether you have an underlying health condition or not. If you don't have one, please make time to complete one. I will put the link to access the form and some wider information in the written message that accompanies this video. A few people have asked how the information contained in the health risk assessment will be used. The primary aim is to capture any individual potential risks to COVID, to make sure we can protect you as much as possible from the virus while you were at work. To date, this is largely focused on whether people work at home or from one of the trust premises, and we've used the information from the health risk assessments to support people with clinical vulnerabilities not to work in areas where we know we have confirmed cases of COVID. As you know, we have not had any positive cases on our wards for some time. Whilst this is a fantastic position to be in, we also know that could change at any time, and it's important we are prepared for that. We know that there remain to be a small number of colleagues who have chosen not to receive their COVID vaccination. If this applies to you, I would really encourage you to reconsider this decision. We are now in a position where we know a lot more about the vaccine, and their safety and effectiveness is really high. The new health risk assessment will capture colleagues who have not been vaccinated. If we are unfortunate enough to see an increase in cases in our services, this information will be really important, and we may need to move unvaccinated colleagues away from frontline work due to the risks that will remain present to you as an individual, but also to our patients and other colleagues. Clearly, we wouldn't want to do this, but it might be a decision we have to take. It is still a personal informed choice, but nationally there is a really clear expectation that all frontline health workers are fully vaccinated. Please receive your vaccine. It is the most effective way of protecting yourself and those around you, both at work and at home. I know there are some colleagues who are pregnant who have been waiting for some further information on use of the vaccines during pregnancy. I'm sure many of you will have seen the updated information issued this weekend that confirmed the advice for pregnant women to be vaccinated. For pregnant colleagues who have no underlying health conditions, there is a preference for the Pfizer or the Moderna vaccine, simply due to more research being undertaken on the use of these vaccines during pregnancy. If this applies to you, please contact our COVID vaccination team to see if they can identify a suitable clinic for you to attend. If you are pregnant, we still need to be careful about the areas you work once you're over 28 weeks into your pregnancy. This is something we will need to discuss and weigh up with you to offer a choice about where to work, which will include the option to work from home. This will continue to apply even after you've been vaccinated, just to ensure we do all we can to protect you and your baby. We also continue to encourage colleagues to take part in the lateral flow tests, particularly if you are going into any of our clinical services as part of your working role. There will be more information in tomorrow's message from the incident management team about how you can express an interest in receiving these tests from work. I hope this message outlines why we're taking these steps and how we're doing all we can to look after our colleagues' health and well-being. If you have any questions, please continue to ask. Thank you.